Everyone, my name is Stephanie Joya and I'm a student nurse at Cedar Crest College. I chose my topic on hippotherapy, also known as horseback riding therapy. I chose it because I'm also a fellow horseback rider and I wanted to see if I could choose a topic that could incorporate my future profession with something that I'm very passionate about. And I stumbled upon this topic of how hippotherapy improves balance in kids with cerebral palsy. So it's significant to nursing because it incorporates different treatment teams such as physical therapy, occupational therapy to achieve the ultimate goal of improving balance in children with CP. It also significantly improves balance. That's what the whole thing was about, and hippotherapy definitely proved to do that in children with CP, as well as functional abilities, so they were more independent from their caregivers. It's also a useful treatment regimen because it forces the children to continuously adapt to the environmental changes, such as like when the gaits of the horses walking, trotting, they had to adapt to that. And it causes their muscles to become stimulated, which then in turn cause muscle strength. And lastly, nurses need to be informed about this for further recommendation because hippotherapy not only helps children physically, but also emotionally. And we need to be able to support our patients in their treatment choice. So we need to further research to be able to really recommend this. So my PICO question was, in children with cerebral palsy, does hippotherapy compared to no hippotherapy improve balance? Also postural balance, same thing. So the process of literature that I did was WorldCat. I really liked that search engine. And my keywords were hippotherapy, balance, and cerebral palsy. And the date range that I chose was 2011 to 2016. And I chose only peer-reviewed articles. Now, I had a total of 9, and I chose one out of that, and I chose it based off of whether it answered the PICO question in its entirety, as well as if it was applicable to the United States. The next one that I used was Google Scholar, and I used hippotherapy or horseback riding, and cerebral palsy and balance. Again, date range was 2011 to 2016, peer-reviewed articles. This one I got 946, and I chose 2, again, based on if they answered my PICO question in its entirety, as well as if it was applicable to the United States. So I chose two of the articles that I had chose were randomized control trials, which were good because the researcher didn't know which group the children were selected into. And it was also really good because you could compare which group was more effective in treating balance in the kids with cerebral palsy. And then the other study was a clinical trial, and this was just observing children with various movement disorders. So my synthesis of evidence. My first article was by Lee et al., and that was written in 2014, and it was titled Effects of Hippotherapy and Horseback Riding Simulator on the Balance of Children with CP. The purpose of this was to compare hippotherapy and a horseback riding simulator on balance. This was a randomized control trial, so there were 26 children, 13 selected to go to the simulator, 13 selected to go to hippotherapy. Both groups did improve balance, but hippotherapy did improve it more. And I think, and the researchers also said, was because the children could feed off of the energy of the horse. Again, going back to that, it's not only helping physically, but emotionally. The next one was Silkwood Shearer et al., and this was written in 2012, titled Hippotherapy, an Intervention to Rehabilitate Balance Deficits in Children with Movement Disorders, a clinical trial. So the purpose was to assess the effectiveness of hippotherapy for management of postural instability in children with mild to moderate balance problems, and also to determine whether there was a correlation between balance and function. So as I said, this was a clinical trial. There were 16 children aged 5 to 16 years old, 9 boys, 7 girls, all had documented balance problems. The result of this one was that there was a statistical difference in the baseline to post-intervention with hippotherapy. And there was also proven to be a correlation between balance and function. So then the last one that I had was Moraes et al., and this was written in 2016, titled The Effects of Hippotherapy on Postural Balance and Functional Ability in Children with CP. The purpose of this article was to evaluate the effects of hippotherapy on seated postural balance and functional performance in children with CP, and as well as to compare the effects of 12 weeks and 24 weeks of hippotherapy. This was a randomized control trial, 15 children. Some were selected to go to the 12 weeks, some were selected to go to the 24 week. The results were that there was a significant difference in those who were in the 24 weeks. Their balance improved way more significantly than those in the 12 week. So the recommendations from Lee et al. was that hippotherapy was good because it improves balance, as well as the simulator, but again, hippotherapy was better. But they needed a bigger sample size, as well as various types of cerebral palsy for the full utilization of the program of hippotherapy. For Silkwood Scherer et al., they said that hippotherapy did improve balance, and it should be implemented more often in order to do a better study. And lastly, from Arrays et al., hippotherapy was definitely improving in static and dynamic balance, and it was a good intervention, but it should be replicated with a larger sample and a control group. So the conclusion is that hippotherapy is a growing field, but we need further research in order to refer it to our patients. It does improve balance and functional abilities, and we need a better understanding so we can be better advocates. And lastly, when nurses can help with the growth of hippotherapy, we can help the growth of kids with cerebral palsy. I really hope you enjoyed my presentation. I look forward to your feedback. Thank you.